Sperm takes about 72 days to develop from the time they start forming until they're mature enough to be ejaculated. So any lifestyle changes you make today might show up in your sperm analysis a couple more months down the road. Today we're talking about something a lot of men and couples encounter on their fertility journey, the semen analysis. We're going to break down what those numbers mean, how the tests are done, and even share a few surprising facts along the way. So let's get started. A semen analysis is typically the first step in evaluating male fertility. It's a straightforward test, but it can give us a ton of information, like how many sperm you're producing, how well they're moving, and their overall quality. The World Health Organization even calls this the gold standard for evaluating male reproductive health. Now here's something you might find interesting. The WHO released its first set of standardized guidelines for semen analysis back in 1980. Since then, research has led to updates and more refined criteria, reminding us that men's health and fertility science are always evolving. Now let's dive into the main things we look at in a semen analysis. Number one, volume. Usually anything above about 1.5 milliliters is considered normal. Number two, concentration, sperm count. This is how many sperm cells are in 1 milliliter of semen. The WHO says more than 15 million per milliliter is typically normal, though higher is most likely obviously better for fertility. Number three, motility. This is how many sperm are actually moving. We like to see at least 40% in motion, but of course, the more, the merrier. Now number four, morphology. Could be a bit controversial, but shape does matter. Using strict criteria, often called Kruger's criteria, around 4% or more with a normal shape is acceptable. Now that may sound like a small percentage, but even a few million well-shaped sperm can go a long way. And number five, total sperm number. This is the total count of the entire sample, factoring in both concentration and volume and motility. Now here's a cool trivia fact. Did you know that sperm only make up a fraction of your semen volume? The rest is fluid from your prostate and seminal vesicles. Another fun piece of trivia. Sperm takes about 72 days to develop from the time they start forming until they're mature enough to be ejaculated. So any lifestyle changes you make today might show up in your sperm analysis a couple more months down the road. So when I review a semen analysis with a patient, I look for a couple patterns. Number one, low count. That medical terminology is oligospermia. This could be due to hormone imbalances, lifestyle factors like smoking or excessive alcohol use, or something called a varicocele, which we'll touch on in another video. A varicocele is a vein issue in the scrotum. There could be poor motility, actinozoospermia, sometimes linked to infections, certain medications, or even consistently high temperatures. Hot tubs, saunas, and tight clothing can have an impact. Now, abnormal morphology, we're going to save that for another video. That medical terminology is teratozoospermia. We'll talk about what that really means in a separate video because that takes its own context of is it important or is it not. Now remember that each parameter is just one piece of the puzzle. You might see a weird shape percentage but still have a good count and great motility, which can potentially balance things out. Now one of the first questions that all my patients ask me is, can I improve my numbers? And the answer is very often yes. Diet and exercise play a huge role. Avoiding tobacco, limiting alcohol, managing stress can significantly improve sperm quality. In fact, a study in fertility and sterility showed men who adopt healthier lifestyles can see real gains in both sperm count and motility. Now another tidbit for you. Sperm can survive in the female reproductive tract for up to 5 days. That's why timing intercourse or insemination around ovulation can make a big difference for conception. Now, if your analysis comes back abnormal, don't panic. It's common to repeat the test after a few weeks because things like stress or even a recent fever can temporarily affect sperm. If it's still off, we may explore a hormone panel, testing testosterone, FSH, LH, or even recommend an ultrasound to check for structural issues like that varicocele I mentioned. There's also more advanced testing like sperm DNA fragmentation analysis, which looks at the genetic integrity of your sperm. That's especially helpful as standard tests don't give us the answers we need. But again, all of this is done step by step, so you're never in the dark. Now here's something new that might surprise you. Semen analyses aren't just confined to clinics anymore. Thanks to modern technology, there are reputable at-home testing kits that let you collect a sample in the privacy of your own home, mail it to a lab, and then receive a thorough, awesome report. It's a huge convenience for people who feel uncomfortable with a clinical setting or have busy schedules. However, if you do go down this route and get concerning results, I strongly recommend following up with a healthcare professional for a more comprehensive evaluation. And that's it. That's the rundown on a semen analysis, what the numbers mean, how they're measured, and how you can start improving them. It's an incredible window into male fertility. So if you're on a journey to start a family or just want to check your reproductive health, getting one done is a great first step. If you found this video helpful, please hit like and subscribe to my channel. Stay up to date on all things men's health. As always, drop your questions in the comments. I'm here to help you navigate every step of the way. Thanks for watching, and I'll see you next time.